Welcome, welcome. Thank you everyone for joining us for this very special Health Equity Forum. Thank you for those of you who are joining us online as well. If you are joining online, just a few reminders, please mute your microphone so that we don't get too much background noise. And if you have any comments or questions, please use the chat. We encourage you to use the chat, give us your reactions. If you have any questions or would like to speak, use the raise hand feature. And please, before you speak, let us know who you are, share your name and your organization. And that goes as well for those of us in person. If you have any comments or questions, please give us your name and your organization that you're representing. And I will pass it along to my colleague, Karina.
Thank you so much, Mindy. Well, the weather outside early this morning was frightful. But the warmth inside here and online is truly delightful. So I am so thankful that all of you have come out to join us, have decided to log in to join us. I can truly see the bright glow of the coming holiday season on each of your faces. Thank you again for joining. I do just want to set the stage for what will take place during this forum. We will have opening remarks from our health officer, Dr. Tony Gedden, and that will be followed by a preview of the Community Health Ambassador Program and their impact in fiscal year 2023. Thereafter, we will have Dr. Harrison give just an overview of just kind of open up the red velvet curtain and give you a peek behind that curtain, just to give you a sense of what we've been doing at the Department of Health around health equity planning. And so we'll have a rich conversation around that. We will also be joined by County Executive Stuart Pittman. He will share his remarks. And we're delighted that he has carved out some time to be with us. And then we will follow up by a discussion on the data that you're seeing around the room. I hope you had some time to digest it, to look it over, to perhaps talk about it. We are going to have an exciting conversation around that data. And so we're really excited about that. And we hope that you will come along on this journey with us during today's Health Equity Forum. At this time, I'd like to turn your attention to our health officer, Dr. Tony Gedden.
Thank you so much. Thank you so much, Karina. And before I get started with the life-size picture of myself back there, I would just like to recognize and thank the Health Equity and Racial Justice team for putting this on today. I know you all know, because we come to your events and we all do this together, that it's no small feat to get all of you here today. So I just want to recognize Karina and Alex and Keith and Raymond and Kristen and Donna and Megan and everybody else from the health department. But I know in Mindy, there's been so much work put into doing this today. And for Dr. Iona Harris, who's going to talk to you more later about what we're looking at and what the data walk will be. But we went through a strategic planning process at the end of last year and released that plan earlier this year. And what did we put in it, right? What was important? We were coming off of the heels of historic pandemic, and as a health department, everyone's, I don't know what we want to do next. We don't want to do anything right now, right? We're tired, folks are fatigued, and how do you think about the next step? But one of the things that really came through very, very clearly in that strategic planning process was the importance of partnerships. And so one of the things in our strategic plan was we wanted to advance our partnerships, and we wanted to diversify those that we were partnering with, right? We learned a really valuable lesson throughout the pandemic. And of course, we've always had partners, right? But we leaned on one another in a way that we had not before. And so really understanding how we're able to get out in the community in a different way by utilizing all types of different partners. And so that's a part of our strategic plan for this year. We're actively working on that and figuring out what that looks like. And you're all a huge part of that. We could not do this without you. We partner with some of you on multiple things, one thing, but it's really fantastic to have you here. One of the other things that came out of our health equity out of our strategic plan was advancing health and health equity. We actually added health equity to our mission statement as a department, right? We found that it was important enough that we wanted it highlighted and not just as a, a piece of the strategic plan that would go and come with time. And then advancing health equity. What does that look like? How are we doing that? And one of the ways that we're doing that is diversifying partners, but also creating very specific and intentional plans, right? We talk a lot about health equity, and there are literally disparities in virtually any health outcome, any social determinant that you measure. And so when we're saying that, what exactly are we doing? What are we talking about? And how are we transparent in what we're doing? How are we collaborative in saying, this is what we should be working on? And how are we coming back to be held accountable for, here's the things that we said that we would do, what did we do? Right, versus we're working on health equity, which is a really broad statement that can mean a whole lot of things. We want to be intentional. We want to be thoughtful, and we also have a limited number of resources, right? We can't do everything at one time. And so really working with folks like you, the community, other partners to decide what are the priorities, right? It's not for us as a health department to set and then bring it out and say, this is what we think, right? We're one piece of the pie, but we're not the entire puzzle. For sure. And so that's going to be coming up a little bit later, but really thinking through what it means. And I'd like you all, when you are working with this data, to think about things like, what does it mean to distribute funding and time and resources differently? What does it mean to have a burden shared equally, right? Whenever we create programs, someone benefits and someone has a burden. How do we distribute those and not just think about, oh, how are we sharing the good parts, but how are we actually sharing the burden of like, oh, now you have to travel further to get here, or maybe it's not in English today, right? How are we sharing those sorts of burdens amongst the community? And then really digging into the structural pieces, and that's harder. When you're looking at what's underlying health disparities are intentional policies, procedures, things that have been ingrained in our society that we then have to undo. I think I'm not the only one to say this here. A lot of people say it. The system is designed to get the result that we're seeing. Sometimes you hear people say the system is broken. It's not. It's operating exactly as it was designed. And those who suffer the injustice of that are intentionally supposed to be, right? The policies, the history in this country is how it was set up. So when we say it's broken, not really. It needs a redesign, not necessarily a Band-Aid. So I want to go to the next slide for me. Alex, thank you. This is just a quick list because this whole event was to thank you for your partnership, for all the things you do with us throughout the year, for continually coming to these health equity forums. We started this during COVID to make sure we were getting information out into the communities, and now it has morphed into so much more, and we cover so many valuable topics. Many of you come there and present, but if not, you continually show up to that month after month to get information from us. And so this is just a list of a lot of the folks that we're collaborating with. And we want to expand this. If there are people who aren't here today that you're like, where's such and such? I thought they would let us know. If you don't see them on the list, let us know. We are actively working to diversify our partnerships and to expand throughout the county into different locations. We hear from residents. We don't really see you as much as we don't have a building in West County, for instance, right? And that's where partners like Aging and Disability come in and allow us to use their facilities, partners like the libraries we're here today. But that's the kind of feedback. Same thing with South County. So we hear things about geography. We hear things about what languages we're presenting information in. Is it translated in Korean the first time, or did we do it as we got to go back? Oh, we didn't plan for that, right? Those are the types of missteps as a health department that we want to start to build into our structure so that it's not happening, that it doesn't require someone to think about it, but it is just what we're doing. Next slide. Okay, so many of you were kind enough to put some time together and tell us about what you do. And we wanted to, as a thank you, also highlight the amazing work that you all are doing. So we reached out and asked for some video submissions. You did that in this video. Now you're regretting it. See, it was funny when I was the life science head. But this is just a little video to highlight some of the amazing work that you all do in the community, what you're doing, and how you partner with us. And so we can hit play on that.
Thank you to the Department of Health and the Health Equity and Racial Justice. We could offer our 21st Health Festival on September 30th, reaching out more than 1,000 individuals. Since 2002, we serve more than 16,000 individuals and families. This festival brings a safe and happy environment as the church is trusted by the community, and also because the people see their authority supporting the festival with their presence and mingling among the families and attendees.
Love Wins Pantry is more than just a source of food. Weekly, volunteers offer love, hope, and dignity to each of our guests. We thought the number of guests would decrease this year, but we were wrong. The number of guests have continued to steadily increase, but so has the number of community members volunteering with us. Some of our most dedicated volunteers are those who started as guests and found much more than food. They found connection, they found community, and they found they could make a difference.
Our agency currently spearheads the Early Childhood Coalition, the recently instated Anne Arundel County Food Council, and our very active Communities of Hope in Annapolis, Brooklyn Park, South County, and West County. Most recently, we purchased 60 bikes for the youth in West County to participate in the 90 Days Without Violence campaign. The partnership is focused on working with our community to provide support and resources in addressing the root cause of health inequities in our county.
One thing that has proven, beneficial and helpful to the community, to making sure everyone, feels safe, happy, and just hopeful, it is just making residents aware of resources that are available that they may not know about.
Our newly built community center for the West County side, where we're able to bring our residents in to gather them for more knowledge of mental health and community safety.
What has worked well for us as health ambassadors doing community engagement and keeping the residents happy is building trust, being consistent and showing we care, and assisting residents with their needs.
Just so excited to celebrate with all of you today our first partnership with the Anne Arundel County Health Department and the Health Equity team in providing our first series of mental health first aid trainings for all of you amazing community partners and supporting the ambassador program in your work that you do in the community. So just super grateful for the opportunity to grow some connections and to build some partnerships.
In Asian community, many health problems went unnoticed because there is a little information about where to get help. Through this Health Ambassadors programs like door-to-door survey, library booth setup, events and classes, there has been active promotion and raising the awareness on mental health and community safety. We appreciate the opportunity as a link to support the health of our community.
We have been working with our residents. In particular, we noticed that there were a lot of immigrants arriving to the United States. The main concern was to get their children started school, so we were able to help them going through the process. Their children need vaccines and also physical exams in order to be enrolled at the school. We were able to help them with them. Children were happy, parents were happy, and we are also happy to be able to provide the assistance they were seeking for. Thank you.
Our customers are really grateful that we continue to offer COVID test kits provided by the health department. Since the pandemic began, we have given out over 338,000 tests and hundreds of thousands of masks. Together, we launched a gun safety lock initiative. Library staff have distributed more than 3,500 gun safety locks, and they continue to do so at all 16 of our libraries. Our community pantry at Discovery's Library at Westfield Mall is going strong, giving out much needed diapers, wipes, and menstrual supplies.
Right, I know for some. some parts of that might have been quiet for those of you in the back, but we will be sharing that out so you can hear what everyone here is sharing and what they wanted to tell you about the wonderful work that they're doing in the community. And so next, I want to tell you about something exciting that we have going on. And Dr. Giona Harris has joined us with the Health Department. There she is up front. You'll get very familiar with her later in the meeting. To talk about how we are putting together our health equity plan, right? What will that look like? And so one of the things that I think you've probably grown accustomed to with the health department is we love our data, right? We're gonna share charts, we're gonna disaggregate it and tell you who's doing what, where, hopefully try to give you some zip codes. But we've got a lot of different reports in a lot of different places. And they don't necessarily all come together to give you a snapshot of like, I wanna know what's going on in this zip code in Odenton, right? What's happening there? But what we want to do is really do a deep dive and what we've started to do into our data so that we can be, again, very strategic about where are we sending resources. I'd love to say that we'll have resources to go around and we'll be able to do everything, but we know that that's usually not the case. And so the data helps us to decide who is most in need, where are they in need, and are we actually making an impact? Are the outcomes changing as a result? Are we seeing differences? And that takes time. But what are the things that you put in a plan like this that then you look back and say, okay, we did do X, Y, and Z, thinking about actual outcome measures, but also procedural process measures and measuring steps that we've taken to get us to better outcomes. And then one of the things that we want to work on is setting goals and objectives, right? We talk very broadly, as I spoke earlier, about health equity and what we're doing, but what are our goals? What are the things that we're actually trying to achieve? And what are the things that we are going to come back to you all and say, this is what we're measuring. This is what we'll be reporting out on. This is what you can hold us to. Next slide, please. So a couple of things in order to actually make this plan a reality. Optimize partnerships and community engagement, right? Partnerships are wonderful. We love it, but we also have to work with the community directly. We have to be out in communities and in proximity to people. I think there's something lost, and if you always come to us, right, and we don't come to you, we're missing a lot of the context around your neighborhood, your stressors, what else is happening, and it's just different when we're in your community. Look to the health department building because we're doing a thing today, and so really talking to our staff and working to do that. And I would like to just recognize again this health equity and racial justice team. They are a little bit of everywhere all the time, and so thank them for that incredible work. And then, as I mentioned, creating performance measures and evaluation. So we know what stage we're at and how are we monitoring our progress. So again, that we put a report out, we said, this is the plan, and then we want you to hear from us incrementally. We don't want you to hear later on, like, whatever happened to that plan they were putting together, which we know happens, but that is not our intention with this plan. And then having a final draft and implementing. And so in the midst of all of this, talking to you all, right? All of the input that you give today, and this is why I want you to really take your time with the data and engage in this conversation. We will use it as we're putting this plan together. We want to do that with communities. So if there are other opportunities that you are hosting or things that we can come to, please let us know so that we can make sure that we're getting a well-rounded opinion on this. One of the other things when you're looking at health equity is who has a say, how are they being asked about it, and is their input valued, right? And those are the things that we want to make sure that we're actually doing. And then getting into implementation. And so we'll see, hopefully this spring, we'll have a plan and then we can start to implement. Next slide, please. And then the last thing for all of the community health ambassador in the room, all of you in the blue and some who might not be wearing your blue today, we have put together a year-end final report for all the fantastic work that you've done with us. And actually starting to share that as of today. So there's a QR code here. There are small business cards at the desk if you want to pick one up and take it with you, but it'll also be on our website. But people making this public for the community to understand the wonderful work that you do, advocating to continue this work is so important. And so we want to just thank you all for all that you've done, all of the testimonies and things that you put into this report you'll see reflected. But please do take the time to look at this. And that's it for me. Please enjoy your day and engage in all of the wonderful things we've got for you.
you so much, Dr. Gedden. All right, so now we get to just dive in a little deep and learn about some of the fantastic work that the Community Health Ambassadors have been doing. And as Dr. Gedden mentioned, you can certainly check out the report. There are fantastic pictures and amazing stories, and so we do invite you to peruse that report at your leisure. I would be remiss if I did not thank the team, the Health Equity and Racial Justice Office team, for their incredible contribution to the work of our Community Health Ambassador, and not just their contribution, but also your contribution. So the Community Health Ambassadors in the room, on behalf of the team, we'd like to thank you. If you can raise your hand so we can recognize you. Our team definitely wants to thank you for your amazing work out in Anne Arundel County. And I'm just gonna highlight some of the great work that the Community Health Ambassadors have done. So what are the Community Health Ambassadors? So for those of you who may not be as familiar, we have partnered with faith-based and community-based organizations. These are our long-standing partners, and they are what we consider the boots on the ground. They are our frontline public health workers, if you will. They're engaging with community members in authentic ways. And they have been able to, in the fiscal year 2023, to engage over 25,000 community members. That's at food distribution sites, community events, that's going to businesses, going door to door. And so we are really thankful for their tremendous efforts out in Anne Arundel County. As Dr. Gedden mentioned, partnerships are so key, and we do rely on our partnerships with our Community Health Ambassadors. Next slide. So who are our Community Health Ambassadors? They are Growth Matters, Heritage Community Center, the Center of Transformation, My Life Foundation, the Center of Health, and Kingdom Care, Community Action Agency as well. So 7 community and faith-based organizations who have been longstanding partners, who are trusted voices in the communities that they serve. And we have around 26 Community Health Ambassadors who are working in the community. And I love this quote from Kingdom Care. They've said, "We believe we have been able to bridge the gap between health services and the community in a way that has created trust and strong relationships." And that really is the epitome of what our Community Health Ambassadors are doing in the community. Next slide. So in terms of impact, in FY23, the Community Health Ambassador Program expanded. And so not only did we address COVID-19, but we also addressed mental health, because we know that the two were certainly tied when we think about the pandemic. And so in 2020, the fiscal year 2023, our Community Health Ambassadors were able to connect with over 800 participants, providing mental health awareness sessions. They also received training in mental health first aid. That's a national curriculum that helps with identifying the signs and symptoms of behavioral health issues. And then not only were they trained in mental health first aid, but they were able to host mental health first aid trainings in their community. And so we were able to connect with just over 160 participants in that 8-hour training. Our Community Health Ambassadors also disseminated masks and hand sanitizers, so many different resources they equip the community with. Slide. And so what we heard from the community, our Community Health Ambassadors not only received training, not only did they host training and provide mental health training sessions, and also equip the community with resources, they also heard directly from the community. So they were able to capture the community's voices in a survey, and we heard directly from communities, what are their top stressors? So many of our community members indicated that economic stress, substance use disorders, as well as mental health stigma are the top stressors that they noted. Next slide. So again, with this rich insight, not only did we receive quantitative data, right, the numbers, but we received qualitative data from our Community Health Ambassadors. And that really helped to inform how we move forward in fiscal year 2024. So just to give you a sense of how we've scaled up and evolved again. So in fiscal year 2024, not only are we addressing COVID-19 and behavioral health, but we're also addressing community safety, access to care, weather preparedness. Again, because we're hearing from the community directly and we're doing something about those emergent and urgent needs. And so our community health ambassadors have received training in how do you administer naloxone, the opioid drug reversal drug? How do you ensure that community members who need it can get access to Narcan? So they've received training in that. We also continued with the mental health first aid training, that national curriculum, but now our community health ambassadors are trained to provide that training themselves so they can go into the community and serve as instructors. And so we've increased not only the number of instructors here in the county, but the number of bilingual instructors for the mental health first aid training. We also are focusing in on community safety. Again, we've heard from our community members in fiscal year 2023, and so we've evolved and we're scaling to meet those needs. We're focusing in on access to care and weather preparedness. And so just to give you a sense of the knowledge base of our community health ambassadors, they received a lot of training in order to then go out in the community and provide information and resources and to host training on the number of focus areas that we just discussed. And so I want to leave you with this thought that when people take action together, the transformative effect is powerful. We cannot do this alone, as Dr. Gettin mentioned. As a health department, there is no way that we can address all of the health inequities in our county, but together we can certainly create an impact. And our community health ambassadors are just one vehicle in which we're doing that, but we're doing such amazing work through partnership and through working together. So at this time, I want to transition to the discussion on what it is that we're doing around health equity planning. And Dr. Harrison will be providing an overview of the work that we've been doing and the work that we invite you to join us in.
Thank you. So again, introducing myself, y'all heard my name a couple of times. I'm Dr. Harrison, Iona. If you can't remember that, my first name is a doozy. So Dr. Harrison may be easier to remember, but you can call me either one. Our health equity planning. So we actually went into detail about some of the steps that we're going to take, but I'm going to go into another layer to detail some of the actual tasks that fall under each. But before getting into that, I want to start with some definition of terms. So there's a lot of data on the wall, and we'll get to that. We've been using a lot of the terms. You've heard social determinants of health, disparities, inequities. And I know that when it comes to these terms, disparity and inequity, they're used interchangeably, but words mean things. And if we want to be intentional, let's be intentional about the words that we're using to help invoke the action that we're looking for. So bear with me. I'm going to give you the definitions of each and try to, tease out those differences because they're small, but let's work with me. Feel free to raise your hand, ask me any clarifying questions if you need them. Somebody hit it one time. So a health disparity is a type of difference that is not preventable. There's going to be a disparity in everything. We've already heard that. Anything you look at, there's going to be differences among groups. So this is not preventable. It may be that this is for a reason or this is naturally occurring. There is something that may be feeding into what we see, but I'll go a little deeper to give you an example. So it is closely linked with social and economic and environmental disadvantage. So you're like, okay, what's the difference? Disparity and equity. So I'll go a little deeper one more time, or you can hit it a couple times. Sorry, thank you. Okay. So although we have health disparities that are not preventable, they often do adversely impact people who are systemically, things are stacked against them systemically. Where we see this difference from a disparity to inequity is that an inequity is a type of disparity that's avoidable. So it's not naturally occurring. It's not that we see these differences in different groups and this is the split we have, we can collect the data a different way. No, the inequity is that this was intentional, that this could have been avoided, there could have been resources provided. And this, although they're different, they are similar because they do stem from unfair and unjust systems, and they do impact typically the same groups. An example in the next slide will show this a little differently. So may you hit all of them, I'm not sure if I started like this. One more time. One more, thank you. So if you look at health disparities, so there's differences in sickle cell disease. And looking at Maryland, 1 in every 767 births, that's a lot of births, in Maryland, and then every 1 in 256 African-American births in Maryland, the baby is born with a sickle cell disease. And what's going on there? I said that should be preventable. It is preventable, but it is due to something else. So it's due to evolutionary trait where if you think of malaria. So if you have folks from countries or with a history from a country that is exposed to malaria, sickle cell is actually something you develop to protect you against it. So what you're seeing is that it's a protective trait, but it does have some unfortunate, health consequences because of it. So that's something that's a disparity. It's not preventable. It's not avoidable. But if we look at these death rates related to diabetes, and forgive me, I do not want to trip on these stories. So you can see here, if you can't see here, you can see, I'm gonna put out this yellow line is much higher than the others. We have blue being the average, so all recent. So you'll see automatically, even if you can't tell who is which one, if I point out that we have non-Hispanic Black residents dying at a higher rate from diabetes, that's a concern. Because we do know that diabetes, particularly certain types of diabetes can be preventable, but what is happening is there's not information that's being shared, health insurance differences, people can't get access to their medicine. What could that be? And we do know that that's something avoidable. So that's what I'm using here to distinguish the difference between a disparity and inequity. It may take time to really grasp these, but you also may see that when you read and pick up things that they just use these words interchangeably. And I want to avoid that as much as we can. So in your own words, please feel free to use this example. Please feel free to educate your teams because it does make a difference in how we show up. Any questions? So here, I'm going to dig just slightly a little deeper. You saw all this information from Dr. Gavin, so it's not new information here. These are the steps that are being used to plan health equity. Health equity can look many ways. It can really be throwing things at the ceiling or the wall, seeing what sticks. But if you want an intentional outcome, you need to go in with an intentional plan. So these are some of the things that we are thinking through. So yes, you want to take that data, that deep dive, and we're going to do that today with the data to understand where are those opportunities for us to advance this work. Data assessments, we do those. We can define and map the inequitable outcomes. There's more to share on that later. And disaggregating the data. So disaggregating the data is a fancy way of saying, how does this look if we break it down beyond averages? An average can hide things. How does this look if we break it down by race? How does this look if we break it down by geography? Are certain residents with certain characteristics experiencing this differently? You'll also see that we have some check marks. Now I'm putting us to task. You'll see a name pop up there a few times, but these are the individuals who want to be a part of this. There should be a check here for community, forgive me, because community is going to be a part of this effort. Some of the things we do today are going to be a part of that effort as well. Next slide. So setting those goals and objectives, we are going to have to do that. And this is where I think of coming in community, a checkbox. And you'll also see data walk. So a couple different things are happening here, but today we're gonna do a data walk. So a data walk, fancy way of saying, y'all see the pictures on the wall? These are what a data walk are. This is gonna be a gallery type style guide. So imagine if you went to an art gallery and you saw art on the walls and you had a guide that would stop and walk you through all the art. I'm gonna be your guide today, and I want you all to really guide with me, because although I'm guiding you, what you see here is really to foster a conversation. I'm looking for you all to be the experts. You are county residents. Many of you all work with county residents. I really want to hear from you all what is going into these numbers, what may be lower or higher. You'll see there's some guided questions over there. What else should be considered? What's the context that we're seeing behind this? Are there things that are really driving some of the rates we see here? Or are there people who are being left out of the conversation? Anything really, even if it's just your initial reaction to what you see here, I really want to have that conversation with you. So we'll discuss that more when we get there, but that is an opportunity for us to have a conversation beyond just the numbers. That's us moving towards solutions. So that's an important step for us, setting goals and objectives with you all. And you all heard about the optimizing partnerships and community engagement, so I'm not going to go too far into that, but I do want to highlight resource assessment. It is not going to do us well if we can only chart the disparities and inequities. That's not gonna be helpful if we don't really understand where our resources are. So we may have a great resource that's only in one part of the county, and how can we identify a resource that can actually serve the other residents in that need? So I'm gonna ask for you all to share with us what resources you know that's gonna be a part of as I'm walking through this. Where are they, if you do know where they're located, and where you would like to see them if they don't even exist. So we do want to make sure that we give a nod to the work that's already happening here. We don't want to make it seem like this is all starting from scratch. We are also gathering that information as well. And creating the performance measures. So again, not gonna go too deep into this because we heard a lot about this, but as you see, there's a couple places where we have a different color highlight and it's underlined. Those are all links. So some of the terms that I'm using, if you want to know more about them or why we selected this for them to be a part of the plan, feel free to click those. They may be better examples if you know of those, send them my way. But these are things that I felt like really gave a quick understanding of why we're doing this then. If you have those questions, you can ask me a little bit more. And then moving to the next part is the last step of that final plan and implementation. There's a lot that goes into the final plan. It's a little bit more than writing it up. That's a big part of it, but it's also how do we disseminate that plan? Where does it live? How do we print it out? What language is it in? What format does it look like? What style? We do know that a long form report, how many of us had that time to read a long report? And we also know that community members should be a part of this. So what makes sense for us to share with the groups? And we would love to hear from you all. Where's a good place to put this? When's a good time to, have this come out? What could it look like if we put it on social media? Understanding what works in, for you and your community, your residents. It works really well when we do this thing. We really want to know that. That's all going to go into a plan because we know that we have to do this together. And if we can't share that plan with residents, then it's not going to resonate and it's not going to be a part of moving their health forward. So that's it for me. I did want to pause to make sure that we left space before we started the data walk. You're checking. All right, so we're gonna give it five to 10 minutes. We're gonna give it some time before we start talking about the data, try to give time for us to have our guests arrive. If you all want to mingle, feel free, but you have packets in front of you. They reflect the data on the wall. This gives you an opportunity to read through those, get your reaction ready. Please write on those, mark those up. If there's something that you're like, I want to talk about this, I have something about this, I want to know more, do that because this is going to be the opportunity once we start back up with the data. Thank y'all.
Thank you. Hi, for everybody online, just wanted to let you know, we are expecting the county executive, if you didn't catch on to that part, so we are just waiting for just a minute to give him a chance to arrive and let him say a few words, and then we're gonna have our own, breakout session with a data walk. So stay tuned and thank you for your patience.
I'm gonna give them some introductions and guidelines. Yeah. There you go. Oh, we're good? All right, everybody. Hey. Sorry about that. Good afternoon, everybody. Hey, guys. Yeah, please. Woo, I appreciate y'all. I am recovering. I lost my voice last week, so it's going in and out, so bear with me. I'm gonna pop a hold in my mouth. Apologies for that. So we're gonna start with the data walk, and if we need to pivot, we can, but we really wanna make sure that we get your insights. We actually have 29, wow, very fast, 29 individuals online, and they are actually gonna be a part of the data walk, but they're gonna be in a breakout room doing similar things, so please know that this is something, if you're interested in doing it for your own, teams, that is something you can do hybrid, virtually, or in person. They're gonna be broken out into breakout rooms using Jamboard, similar content, having their own discussion. But I wanted to make sure I let them know that we're gonna move on, so you all will be picked into some breakout rooms. I'm not sure if you have to accept or not, but Donna will be moving you along, and we'll be meeting together to quickly discuss all that was shared. All right, so we're good to go. This is a data walk, but it may be a data run for me because I'm gonna be running on both sides. Y'all send me where y'all wanna go. Don't worry. I know where it's at. I'm just trying not to trip. If I trip, don't laugh at me, please. That's all I ask. I'm gonna start here, but after that, I will let you to guide me. And this is quickly, Anne Arundel County Community Snapshot. It should be the first page in your booklet, second after the welcome. Okay, great. And it's really just going over what you all may already had some insight on. I've already had a quick discussion about some of these numbers, but Anne Arundel County, large county, very, very large county. And then, also surrounded by water. So again, I want you all to think about the county, not only as an experience, but also the landscape of it. We know that some people are more rural than others, so those are things that we're also gonna talk about. But quickly, we have over 500,000 residents. And of those residents, we have close to 10% being an immigrant, and but 17% is compared to Maryland, so it's lower than Maryland on average. We have 63% of residents are non-Hispanic white, that's actually higher than Maryland. Maryland has 47%. So Maryland is a little different from the rest of the US as a whole, so it is more diverse. But if we look at Anne Arundel County, there's less diversity than we have in Maryland, due to that comparison. So I really want to hear from y'all as it comes to those, some of the unrepresented groups. As you may see, please bring them up, because as you see, as we move on, for example, although Anne Arundel County has a high standard of living overall, we hear about 50% of the residents with a college degree,
So for those of you who don't know me, my name is Megan Pringle. I'm the Director of Communications at the Department of Health. I hope that we're ready to share this with you. I don't want to jump over things, but we earlier in the year had a series of open houses to let people know about our Healthy Communities program, and some of you were there, and some of you would sort of ordered and asked, you know, about health equity. What does it mean? And why is it important? And they're pretty broad and basic questions, but we wanted to do something with the answer and then move it forward. So I wanted to share some of the answers that we got from some of the people that we talked to at this particular event. So if you don't mind taking a look at this, and then we'll just ask for more engagement moving forward.
Sorry, guys. Sorry, they can't hear from the Zoom.
Oh, that's the problem. Alex will tell you it. We always have a technical hiccup somewhere along the way, and he always saves us. So.
Taken care of. What it does is that it expands Medicaid to this population, and also it gives them Medicaid 4 months after they give birth.
It's got to do with housing, it's got to do with income, it's got to do with violence in communities that kids grow up in. It's got to do with education. There are all kinds of things that impact the social determinants of health.
Health equity, I believe, is making sure that everybody has an equal playing field, or whatever that might be. If somebody over here has a certain advantage, it's making sure that others have that same advantage as well, so that everyone has what they need.
Health equity says that we are pinpointing, making sure that these communities, we tackle the disparity and be able to allow these communities to have the same access and opportunity that other communities have been afforded.
If we're not physically healthy, mentally healthy, spiritually healthy, if you believe in that sort of thing, it's difficult to get to the next thing, whatever that thing is.
It's important because when we have healthier communities, we have safer communities, and we have healthier people. Our schools are better, our neighborhoods are better, our families are better, our churches become better when everybody's healthy.
We want to make sure that we're doing as a health department is eliminating health disparities and making sure that health equity is a priority, and that we highlight where those disparities exist so that we can appropriately address them.
We have an opportunity to employ resources, to employ tools to make investments so that everyone has the opportunity to achieve their best health. Everyone has the opportunity to live as long as possible.
Health equity is when you take into account that other people are not coming to the table with the same set of resources or opportunities as others. And when you do that, you allow people who don't have those opportunities or resources the ability to gain access and have proper health care.
It's extremely important because many of the individuals within our community do not have equal access to health opportunities on health services, and we need to make sure that each person in our community has access to all the health services and opportunities that they can afford or we can provide.
I'm so proud of all of you for helping us, and I look forward to working on health disparities and many other issues in this upcoming session.
The length of the life that you live, the quality of the life that you live, and to say that something like your race or income level or country of origin has a tremendous impact on your ability to live a healthy life is, to me, a real injustice.
So what the Department of Health does to me is the most important thing that government does. It is make it possible for people to lead healthy lives. And that's what we want at the end of the day, is to be healthy and for our loved ones to be healthy.
So if you look right here, there's an email address, healthequity@aacounty.org. We would love to hear from you. Not just about what health equity is. I think we heard a bunch of different answers, but how do we now achieve it? How do we get there? And wrap it up with discussing what's the most important thing in your community and starting to dig into ways to find solutions. So feel free to contact us. We would love to put your voice into the conversation and hear from you. So reach out to Karina if you didn't get that email address, and we'll get you all set up.
All right, so if you enjoyed today's conversation, if you want to hear more, if you have recommendations for how we can improve, I do invite you to share your feedback using that link, and you can just let us know what you'd like to see in forums in 2024. Next slide. So we've come to the end of today's forum. Feel free though to take your food, to mingle. We do appreciate your joining us, and we invite you to check us out on AA or Anne Arundel County Department of Health's website at aahealth.org/purge. Thank you all for joining today.
Thank you.